ప్రభుత్వం ద్వారా జనహితార్థం జారీ. లాక్ ప్రక్రియ దేశమంతా మొదలైపోయింది. అటువంటిప్పుడు
Sir, Ramalingam sir will join within a few minutes. So he asked to start and he will be joining, sir.
Okay.
Yes. Sahithi?
Yes, sir.
Yeah, ma.
So shall we proceed, sir?
Yes, ma. Yeah.
Good morning, all. Good morning, Principal, sir, respected speaker, and all the respected participants. A warm welcome to Riper Alumni webinar on Prism of Career Opportunities for Millennial Pharmacists, organized by Department of Pharmacy Practice, IPA, Indian Pharmaceutical Association, Anantapur branch, in connection with Indian Pharmaceutical Association National Pharmacy Week 2020 with the theme Pharmacist Frontline Health Professionals. Hope this webinar gives a brief outsketch about career opportunities and skills required by pharma aspirants for the professional growth. In this regard, I request Dr. Y. Padmanabh Reddy Garu, Principal Sir, to address the gathering and give inaugural speech.
So thank you, Sahithi. Very good morning, all of you, and in particular, Dr. Deepak Barambe. Very good morning to you, and it's a pleasure for me to be with you all on this particular day for the national webinar, which is going to be organized on the prism of career opportunities for millennial pharmacists, which is coinciding with the National Pharmacy Week celebrations of IPA, Indian Pharmaceutical Association. So I would like to congratulate particularly the IPA local branch headed by Dr. Ramalingam as well as Honorable Secretary Mohan Ras for bringing out such a beautiful program for the regarding the career opportunities for the PharmD graduates. So this is the second in the series of alumni webinars which are being organized by Riper, and in particular the first one, I think most of you might have participated in the first webinar that which is organized, particularly inviting the speakers who are settled in abroad, particularly the opportunities in abroad. Now, in the second of this alumni webinar series, our team, particularly the pharmacy practice department, has focused particularly the exploring of the possible opportunities for the PharmD graduates in healthcare settings. So all the three speakers who are listed for today's program, Dr. Deepak Barambe, who is working as clinical pharmacist in medical services, particularly in Sandhya Sahyadri Super Speciality Hospital, Pune. And the afternoon, there are two sessions. One is from 1 to 2 p.m., which is going to be taken by Dr. Suvarchala, who is working with IPC, Indian Pharmaceutical Pharmacopoeia Commission, particularly the Pharmacovigilance Program of India, in the Department of Patient Safety Pharmacovigilance as associate. And the third one, third of this today's program is going to be taken by Mr. Teja, who is working as Senior Associate Manager, Pharmacovigilance at Eli Lilly, Bangalore. So I hope all the three alumni of our particular institute, Riper, they are going to share the opportunities which are available in healthcare settings, particularly in the national healthcare settings, so that it will be useful for the PharmD graduates to utilize that opportunity and get benefit out of it. And I wish this program a grand success. And also, I would like to once again thank all the resource persons, particularly Deepak Barambe and Subhachala and Teja, for coming out and sharing their valuable inputs for the benefit of the present PharmD students. And I also thank Indian Pharmaceutical Association IP Anantapur local branch for bringing out this webinar on the eve of National Pharmacy Week celebrations 2020. So thank you for giving me this opportunity. Thank you, Anna.
Thank you, sir. Now I request Mohan sir to address the gathering.
Thank you, Sathi. Good morning. On behalf of Raghavendra Institute of Pharmaceutical Education and Research, Raipur Autonomous, we convey our heartfelt thanks towards the interest of all the participants to attend this national webinar, which is an alumni webinar of Raipur on the topic Prism of Career Opportunities for Millennial Pharmacists. And it is organized by the Department of Pharmacy Practice, Raipur Autonomous, in association with Indian Pharmaceutical Association, IP Anantapur branch, on the eve of National Pharmacy Week celebration 2020. And this particular Raipur Alumni webinar is a continuation of our previous International Alumni Webinar series, which was conducted on October 2 to October 3, 2020, drawing nearly 6 speakers from various parts across the globe, particularly from US, Gulf, Canada. And there was this particular webinar of October 2 and 3 was well appreciated by most of the professionals and students community, but they have put forward certain other feedback regarding why can't Raipur can come up with a national perspective of job opportunities. So what this particular webinar was designed on their feedback and their notice that we have right now for this particular day, we have came up with 3 alumni, reputed alumni of Raipur, who are working in a corporate setting of hospitals and also in the industries, where they will be sharing their views, which may be a very higher view of roadmap for the millennial pharmacists. And I thank all the speakers for getting associated with Raipur amid their busy schedule, for enlightening the upcoming generation and to be a mentor for the careers and creating a roadway and also a platform for the opportunities. So I firstly thank all the speakers for accepting our invitation and getting associated with Raipur. And I thank we convey on behalf of Department of Pharmacy Practice, Raipur Autonomous, our sincere thanks to our beloved Principal, Dr. Y. Batmanabha Reddy sir, for helping us in all this pandemic to come up with webinars like this. I think this is a second webinar, and based on the support and the guidance which is constantly from our management, Raipur and the faculty members, we are also planning for a webinar regarding education and teaching methodologies in the upcoming weeks, which will be communicated to you at the earliest. So once again, I thank all the participants for your active participation. And my sincere thanks particularly to the IP Anantapur branch, the local executive committee member, the president, Dr. B. Ramalingam, and the vice president, K. Varalakshmi, and the joint secretary, Mr. Narayan sir, and also the other LEC member, Dr. B. Pradeep Kumar, Dr. C. Harinath, Dr. U. Virendra, B. Kishore Kumar Reddy, and all, and also Dr. M. E. Jyoti madam, for coming up with organizing this 1 week of program. for the benefit of the student, and also to create an awareness regarding the contribution of pharmacists during this particular pandemic. And lastly, our sincere thanks on behalf of RIPER and IP Anantapur branch to Indian Pharmaceutical Association, CEC, for their overwhelming response and support for both the institution and IP. Thanks for the opportunity, and looking forward for your support in the upcoming proceedings of Department of Pharmacy Practice, RIPER Autonomous and IP Anantapur branch. Thank you all. Over to you, Sathi.
Thank you, sir.
Yeah,
With this, without any delay, we'll move to our first session by Dr. Deepak Barambe, clinical pharmacologist, medical services, Sahyadri Super Specialty Hospital, Pune. Dr. Deepak Barambe, sir, has completed his Bachelor of Pharmacy from SND College of Pharmacy and his Doctor of Pharmacy from Raghavendra Institute of Pharmaceutical Education and Research. And sir has a postgraduate diploma in pharmacovigilance and clinical research from Innovative Center for Biosciences, Bangalore, and also had a board certified medical affairs specialist. Sir has a past experience of clinical pharmacologist in Aditya Birla Memorial Hospital, Pune, and has worked as senior clinical pharmacologist, Fortis Hospital, Mumbai, and also worked as research associate trainee in IGBio Clinical Research Private Limited, Bangalore. With this huge background, sir is going to help us in explaining us how a pharmacist, a pharma aspirant has to prepare ourselves in if we want to aspire our future growth in clinical sector, especially as today's changing Indian healthcare system. Sir has different publications in various reputed journals and has attended various training, CME and CPE programs. And sir has delivered lectures and many national and international conclaves. Sir has particular interest in incorporating new concepts in clinical pharmacy practice with the intention of evolution of clinical pharmacy in healthcare organizations. And with his motto of life, to make use of every opportunity with full physical and mental capacity for the growth of clinical pharmacy. With this motto, sir is working on for the growth of pharmacy and healthcare sector in India. With this brief introduction, I would like to invite Deepak sir to start the session.
Deepak, you're not audible. You have to unmute.
Deepak, you are muted, Deepak. Yeah.
Yeah, I'm audible now.
Yeah, audible. Right now.
Yeah. I'm first of all, I'm thankful to Saiti and the Raghavendra Institute of Pharmaceutical Education and Research who gave me the opportunity to discuss and to just communicate with you regarding the clinical pharmacologist transitions and transformations in India. Then I'm thankful to Dr. Y. Padmanabha Reddy sir, principal sir, who really is my ideal by developing a lot of pharmacy services and pharmaceutical education in all over means in the South India also and in the North India also. But just when I am giving my experiences regarding Raghavendra Institute, so every North Indians in the area of Mumbai and Pune colleges who will really interested to visit the RIPER for the clinical services. And special thank to Mohanraj sir for giving me this great opportunity to talk on Indian healthcare and clinical pharmacy transition and transformation. I'm not going to take more time and we'll start these sessions for our today communication or discussions on Indian healthcare and clinical pharmacy transition and transformation. So before going to start the sessions, I'm not going to take much longer or want to discuss on the things, whatever the we are doing in the academics and in the other sectors. We are especially concentrate on healthcare, where the role of clinical pharmacists, what we are doing in the our active role or practical role in the base of medical services or in the healthcare services. So we are a most important person in the healthcare services where we can discuss a lot of clinical therapeutic reviews, a lot of therapy changes and all things in the clinical setup. So I'm not taking a much time, and we are just going to discuss on the session. Actually, hello, sir.
Yes, sir.
I'm not able to share my screen.
1 second, sir.
Deepak, Deepak,
Yes, sir.
uh, its voice is very low. You can raise your voice. Maybe I think you can keep that nearby while you are going to speak.
Am I visible now?
Yeah, visible. You are
Audible.
visible.
Audible.
Yeah, audible.
So now is clear audible, or can I want to keep the headphones?
Now audible clearly.
Okay, sir. Okay, sure.
Deepakana, you can try to share now.
Thank you so much. Yes. So we are going to start our sessions, that is Indian healthcare and clinical pharmacies transition and transformations. So before going to start clinical services, I just want to take you on the Indian healthcare. So I'm not going to do much discussing on the Indian healthcare, but there is an overview of Indian healthcare, what actually, uh, as we can say, hierarchy of Indian healthcare, what is the structure of Indian healthcare. So as of you know, in India, in the healthcare, there is a physicians, there is a nurses, there is other medical staff, paramedical staffs are there, but as we can see, where is the pharmacist and where is the clinical pharmacist? So there is a lack of uh, as we can say practices regarding the, as we can say, pharmacist is coming under paramedical services, and the we are as a clinical pharmacist, we are just a back of everything, because no one know, there is a uh, um, uh, very less awareness in the community or in the other sectors. So in the healthcare, as we can see, as a healthcare, there is a organization we will think on the back of that to services, value added services regarding the pharmaceutical services. So when their organization will think on the, or Indian healthcare organizations will think on the value added services, we are coming the first, because we are the peoples who will develop a lot of hospital and clinical pharmacy services, which is total motto and everything is regarding patient safety and quality control. So for our main work in the healthcare system is a medications management. So as per medication management, what is the things we are doing in the healthcare system, what is our specialties, what is the career opportunities, and how the healthcare will transitions, means as a clinical pharmacist, how Indian healthcare organizations will started to appoint a clinical pharmacist to looking for, sorry, look for the clinical pharmacist to develop a medications management actively, and how to improve the quality in the medication management. So for that, they are started to appoint a clinical pharmacist or clinical pharmacologist with support team of healthcare team. Okay. So as we know, what is meant by clinical pharmacist? Sorry, what is the role of clinical pharmacy, or what is a clinical pharmacy mean? So everyone knows that clinical pharmacy may be defined as a science and practice, of the rational use of medications, where the clinical pharmacies are more oriented towards the patient care. This is a general definition. As we can see, there is a healthcare professional, so the clinical pharmacist will promote the rationalization and optimizations of medication or therapy management. He will do the medication management for the wellness of the peoples or wellness of the patients. But is the extent of clinical pharmacy that is defined in the American College of Clinical Pharmacy is the Western practice, as we can say. But in the India, as we are PharmD peoples, we are come in the background, or we are come in the front of the healthcare team. So in that, this is actual definition which will apply on the Indian scenario also nowadays. As I'm working from last 6.5 years, where the continuously development in the clinical pharmacy. So now we are concentrating on these things which will be given in the definitions of American College of Clinical Pharmacy, which is the disciplines of embodies the applications and the development of scientific principles of pharmacology, toxicology, therapeutics, and clinical pharmacokinetics, pharmacoeconomics, pharmacogenomics, genomics, and other allied science for the care of patients. So this is the definition. As we are just hearing that it's not happening in India, but as I'm working, it's happening in India. Just we want to keep our efforts how we are doing and how we are developing a clinical services in the healthcare. So our organization, some people or some of the colleagues or some of the students will say, after a PharmD, there is no scope of clinical pharmacy. There is a lot of other scopes are not there. Just we are doing a PharmD. But as per my knowledge, if you are keeping a efforts to prove yourself in the healthcare system, so they are not looking for you just for the medications management or just a quality coordinator or just a documenting works. But if you are keeping your continuous efforts to develop a clinical services, so automatically you can get a lot of appreciation and lot of supports and a lot of work in the clinical team. So clinical team that will look into the next slides. What is the clinical team will do? What is the opportunities for clinical pharmacists in the healthcare system? What he can do in the healthcare system? So that's everything we'll run in the next slides and our session. So how does clinical pharmacy will differ from the pharmacy? As we know that in the healthcare system or in the community or every mind is the one setup. There is a healthcare system, there is a pharmacist, just a paramedics who will just dispense the drugs. But there is a, as we can say, there is a new term clinical pharmacy in India, but it's not new now. It's completed 10 years or back, as we can say, 12 years is completed. There is a phrase came as clinical pharmacy. I'm not telling that a pharmacy and clinical pharmacy is a differ, but as we can concentrate as a basic qualification and as a basic views, pharmacist, we are first a pharmacist, then we are developed in the clinical services. So in clinical services, we are just learning the therapeutics and a lot of other pharmacological, toxicological, biopharmaceutics, the main subject which will concentration, kinetics, dynamics, and all things. But is the basics from the pharmacy field. There is a basic is most important. That will be, as we can say, if we have a knowledge of the formulations and developments and everything, chemistry of the drug, so automatically it will take in the your practice orientations for the patient benefits. Okay, so as we can see here, the disciplines of pharmacy embraces the knowledge of synthesis, chemistry, and preparation of drugs. This will be definition of pharmacy. As a pharmacist, as a diploma of pharmacist, bachelor of pharmacist, and master of pharmacist, who will just keep it. If the community in front of community, if we are going in front of community, so they will just think, yeah, pharmacy is just dispensing a drug. Other than that, if someone is knows regarding pharmacy, he will say, yeah, they will do the synthesis and they will just manufacturing drugs and they are preparing some packaging and all things. But beyond that, what is the role of pharmacy? What is the role of clinical pharmacy? If beyond that, as we can see, the pharmacy practices. So in that coming the role of clinical pharmacy. So clinical pharmacy is most oriented to the analysis of population needs with regards to medicine, days of administration, pattern of use, drug effects of the patients, the overall drug pharmacotherapy management. Okay, am I audible? Because in middle, just let me know am I audible or not.
You are audible, sir. You are audible.
Okay, thank you. The focus of attention moves from the drug to the single patient to the population receiving drug. This is the role of clinical pharmacists what we are doing in the healthcare systems. So as we are looking for the clinical pharmacy opportunities and clinical pharmacy developments and transition transformation. So what is the main requirements as a clinical pharmacist? So main motto or main aim is the patient care. Patient safety is the main motto that we want to keep as a clinical pharmacist in our minds. So as keeping this point in our mind, so we want what type of expertise in our practice. So we must need to be have a thorough knowledge with the drug therapy, thorough knowledge on disease, thorough knowledge on laboratory and diagnostic skills, communication skills, patient monitoring skills, physical assessment skills, drug information skills, therapeutic planning skills, and non-drug therapy skills. So this as a curriculum of PharmD, we are learning everything, but how to apply on that? How we can expect the opportunity on that? How we are going to be a clinical pharmacist in the healthcare setting or not in the healthcare setting. There is a private settings also there. They are providing a clinical services. So how that clinical pharmacist is enroll in that? As I can say, knowledge of drug therapy. As we can say, as a, for example, aspirin. as a cardiac arrest patient or the heart related patient which comes to the hospital, as per American College of Cardiology or New York Heart Association, which will give the total therapy guidelines of the cardiac patients. So as we are taking an example of aspirin, there is, I am asking a PharmD students, what is the aspirin? They will just generally says is just as we can say anti-platelet agent. So what is the difference between PharmD student as a pharmacotherapy specialist and what is the difference between MBBS or MD specialist? They also know that is the antiplatelet. What is the difference in that? So there is a knowledge of drug therapy means is not just to tell that the just a class of that drug. It's an understanding or knowledge on the drug related all things, absorption, kinetics, dynamics, and mechanism of action. That will be aspirin will be platelet aggregation inhibitor. So what is that? So that is the most important thing. How it's happened? What is the role of that drug? Can we give a single drug? Can we maintain a dose? Why the boost drug? What is the why the aspirin is a boost drug for cardiac arrest patient? Why they are giving us 7 tablets once? There is the questions comes in your mind when you are working as a clinical pharmacist. That that questions you want to come in your minds and that you want to clear on the front of the patient and in the work with the healthcare team, because it's not just a simple way that you have a just drug knowledge. That is not the simple thing where you want to be expose yourself, because already healthcare team they have a lot of knowledge, they have a lot of knowledge in the disease and diagnostics, but as we can say they have a little knowledge on the drug therapy, they have a little knowledge on the pharmacology. Okay, so as a consultant point of view, as a physician point of view, they are expecting PKPD. Okay, pharmacokinetics, dynamics, what is the action, what is the happening when we are giving something to the patients, 4 point drug, but there is no progress in the patient. So there we are coming into the loop. What is the things what we want to do? So when we are managing a therapy, when we have a proper knowledge on the drug therapy, so we can easily crack the problems and we will get uh, we will solve the problems and we will discuss with the physician teams and we will come with the proper and appropriate therapy for the patients, and that will be less therapy, and that will be less therapy with appropriate cure within a time limit. So that is the expectance from the healthcare organizations. Knowledge on diseases. As we can say, knowledge on diseases, we are learning on disease related diabetes mellitus. Just hearing and writing a papers, that is not so important. If you want to be decide a therapy, first of all, you knows the disease related, how the prognosis of that disease, what is the pathophysiology of disease, because every step have the drug, and that drug is required or not, that is a decision making. Okay, so at which condition, at which is there is a cardiac patient, that patient is getting continuous ventricular tachycardia, what is the drug of choice? As we can go with one by one, there is a lot of things can be discussed in this topic, but there is a limitation, so we will just go with, just I'm giving an idea what is the clinical pharmacist role and what is the expectance from Indian healthcare nowadays. Okay, so there is a ventricular tachycardia, what is the drug of choice, that is the question. If that question comes to you as a clinical pharmacologist, clinical pharmacist, what is your answer? That is most important. If you are saying the any drug related to that, means ventricular tachycardia related, you can say any drug, inotropic supports and that things is not required. Most important thing, antiarrhythmic drug, that is a cardarone, which we want to give by injection infusion. Okay, that is the most important thing you must need to know. What is the important thing and what is the point of care? As that point, what is required? That is with thorough with the disease and with the drug therapy. Then knowledge on laboratory and diagnostic skills. If you don't know the knowledge on the laboratory and diagnostic, like the CBC, you don't know the normal limits, you don't know the renal function. We are learning everything. I'm saying as a pharmacy candidate, we are learning everything, but we are not concentrating on that and we are not keeping that in practices. Okay, so as a laboratory and diagnostic skill, as we know, I can say renal function test, what is the parameters we look in that? As liver function test, what is the parameters we look in that? Why it is important? Sodium potassium chlorides, why it is important? bicarbonates, why it is important? If we don't know that thing, so how can we manage the therapy? That is the first question. And how can healthcare can expect from us that how the clinical pharmacists work? So they will just look clinical pharmacists at just documenting works. But we are not just for the documenting. We are the persons who will give us suggestions and to give a proper medication therapy to the limit. Okay, that is our prime role. Communication skills, most important. As we can say, doctors are not hearing. There is a working clinical pharmacist I am with in my context. So I'm just asking them. They will continuously saying, "Sir, doctors are not listening. Doctors are just doing their work. We are saying them. There is interaction. There are a lot of things, but they are not listening. Why they want to listen? First, improve your communication skill. That is the most important thing, because when you are suggesting or when we are advising or when we are discussing something, we want to be thorough on that. We want to be go with evidences. Okay, because they are also working from last 20 to 25 years in the healthcare system as a diagnostics. We have came just now, so we have to keep this in mind. That will be in our hand how we want to be communicate. That is the most important. That everything we chapters will be covered in the PharmD curriculum. Just we want to understand what we want to do in that. Patient monitoring skills, physical assessment. I'm not going with that. That everything is knowledge of non-drug therapy. Yeah. So as a knowledge of non-drug therapy, what is the points will come in your mind? What is a non-drug therapy? There is a lifestyle modification. There is a life diet changes. There is a physiotherapy requirement. That is the lifestyle modification. That is the non-drug therapy. This is the most motivational things as a psychosis because this patient is in long time in the hospital. So we want to be motivated to patients to come out from that because he is taking a lot of medication. He's a long time in the hospital. He will just demotivated and he will just taking a medication. He will be depressed. So that is a non-drug therapy most important for that patient that you want to understand. So these all things will be required for the clinical pharmacies. Am I audible?
Yes, sir.
Okay, great. Then what is the levels of action of clinical pharmacies? There is a clinical pharmacy activities may influence the correct use of medicines on three levels. First is before prescription, during prescription, after prescription. I'm just saying you the opportunities, and in that opportunities as a clinical pharmacist, what is his role, what he is doing and the each level. That is most important. Just understand it. So before the prescription, what is the role of clinical pharmacist? So there is a clinical trials, there is a formularies, there is a drug information, drug related problems. So, as in the healthcare systems, as a patient comes in the hospital, first the diagnosis is happened. Just the impression, it's not a diagnosis. It's maybe, if the patient came to hospital, it's maybe something. But if that patient in chronic diseases, patient is on some medication, so we want to think on that. It's maybe drug related problem or it's maybe disease related problem. Okay, so that's we will call a medication reconciliation. That is the most important thing as we can see in accreditations like NABH and JC accreditation. So all accreditations they are giving the terms medication reconciliation means past medication history taking and count and reconciling that and giving a correct therapy, appropriate therapy to my patient, best possible medication therapy to patient. Okay, so if there is a drug related problem, first stage only we want to stop that drug. We want to found that it's any drug related problem is there that in patient. So that patient will become in the OPD, or that patient will become in the emergency unit. So there is a reconciliation will happen and on admission, and then we will evaluate the therapy of that patient. If the drug related problem is there, we will discuss with the consultant. We will decrease the dose, we will omit a drug, or we will take a decisions with the healthcare team and we will send back to that patient with best care of therapy. Okay, what is the role in clinical trials? So as a clinical pharmacist, we have very different clinical research coordinator, clinical associates, but as we can say clinical trials approval committee, there our role is a medical scientist as per ICMR. So we are a whatever the protocols developed by the clinical research associate team that will be evaluated by the medical scientist as a clinical pharmacist and will give our suggestions on that what is the treatment protocols, what is the inclusion exclusion, what is the analytical things we want to suggest to the team to continue of the trials. So that is the main work as we are doing. Formularies development, yes, in the healthcare settings, there is a hospital formulary, means choice of the medications, means what are the available in the hospital that we want to be suggest the consultant. So how is possible? We are not going to connect with everyone at each time 24 by 7, but there is easy access of formulary. What is the drug available in my hospital? So that will be prepared and that will be maintained by clinical pharmacists. Drug information. If any doctor, any physician, any healthcare worker, or any consumer have the queries, that will be solved in the drug information. That will be evidence based, as you can provide them the suggestions on quick levels. There is not that you want to be convey now you got a drug related query and you will give after 4 or 5 years. So it's a quick access or quick things that we want to do in the your clinical pharmacy as you are working as a practical pharmacist, practical clinical pharmacist, or practical clinical pharmacologist. There is no timing for the waiting. In the intensive care units, if you are giving now someone is asking you and you are giving answers one day back, what is happening? Patient is a critical and you are giving answers after 1 hour, 1 day, or after a few hours. It's no chances there. So you want to develop your therapy practice, develop your knowledge on that, then you want to come up with that. And it will comes by practice. Okay, and it will give a great opportunity to you to work in the healthcare settings in appropriate clinical services. Then as second, we will say during the prescription. What is the during the prescription? Counseling activity. Clinical pharmacists can influence the attitude and priorities of prescriber in their choice of correct treatments. The clinical pharmacist monitor, detect, and prevent the medication-related problems. The clinical pharmacist pays special attention to dosage of drug which need to therapeutic monitoring. Okay. Community pharmacists can also make a prescription decision directly whenever the over-the-counter drug is counseled. So these all things. Hello.
You are audible, Deepak. You can continue.
Yeah. Okay. I'm clear. So counseling activities, as we can say, there is a at the time of during the prescription, there is the most important thing counseling activity. So as we can say, RMOs, clinical assistant, there is a DMB students who will take the informations from the patients, past medication history, medical history, and all things. But what about the medical counseling, medication counseling? Because on admission also we need to know that what is the patient will take. If he have any allergies, if he have any hypersensitivity reactions or by some drug, that all information collected by clinical pharmacist. He have the attitude and influence when priorities to prescriber in their choice of correct treatment. Okay, we are not going to fight or we are not going to ignore a consultant or physician treatments. We are just giving us suggestions for as per therapy. Okay, so just communication most important in that, and most important thorough knowledge on the therapy. Okay, then monitor, detects, and prevent medication related problems. So medication related problems, as we can say, medication errors, drug drug interaction, adverse drug reactions, then we can say other than that food drug interaction, that's all will be managed by the clinical pharmacist on monitoring on daily basis. The clinical pharmacist pays special attention dosage drugs, like there is a RT patient, there is a psychiatric patient, or there is a vulnerable patients, as we can say. There is a different backgrounds of patients. There is a chronic patient. So every patient, there is a pediatric patient, gynec patient. So every patient has the different dosage form selections. There is a dosage management. There is a strength management. Every patient, liver function test is abnormal. LFT, as we know that serum creatinine depends on that we want to decide antibiotic dose or if we want to decide a drug dose. So what is the calculation? What is the formula for that? That's everything want to be do in the healthcare setting by the clinical pharmacy. And is the expectations? This is the expectations from the healthcare organizations. So you want to be follow that all things by your own way. It's not that whatever you are doing and whatever you are following in the healthcare setting, that is not important. What is the expectance from the healthcare organization, that is most important. Okay, so they are expecting just a documentation and you are just doing a documentation, you can't do. You want to be keep thorough on that. You want to go on rounds, you want to be prove your knowledge in front of the healthcare. I'm not saying that through your knowledge. I'm saying do your practice. Automatically, you can come in their minds. Okay. Once they are not when they are not listen, second time they are not listen. But once you are continuously be in their touch or be in their front of their eyes, automatically they will understand the things and they will just ask you the some queries related to therapy. And if you are thorough in that, so you that day onwards your day will start. Like I have past experiences. There is 6 to 7 months. There is a consultant who will not listen to me. It's my first experience when I started my career. And continuously I am also getting a questions why they are not listening. But I have not stopped to tell them. I'm continuously suggesting them something. I'm continuously be in their touch. I'm continuously expressing and just discussing the cases with them. They have a lot of their mind. They have their minds. They are their points of view. They are their clinical studies. But what you are finding or what you are going to tell them that you for that point you want to be thorough on that, so that thing will give you a good confidence to talk with them. And they will also understand once they are not received, but once they are acting on that, they will understand, no, this person or this is a clinical pharmacist which is most important in our practice. And whatever he will suggest, they will think on that and they will change the therapy. Or they will think on that and what we can say, they will give a chance to you to uh, think on the therapy and to decide a therapy. Okay, so it's a progress and it's an opportunity that you can develop your clinical services in the healthcare organization. Then as we can go with the after the prescription or in the medication related problems, last session I already discussed untreated interactions, drug selection, dosage, medication failure to receive a medication overdose, adverse drug reaction, drug interaction, and medication use without indication. Okay, then the after the prescription, as we can say, after the prescriptions, there is counseling, preparation of personal formulations, drug use evaluation, outcome research, and pharmacoeconomic studies. Most important thing. As we can say, as a clinical pharmacist, sir, these all things we can't do. We are just doing our counseling. But it's your role. It's you are not doing or healthcare not expecting from you. It's a different thing. But if you are a clinical pharmacist, you want to develop the things. You want to keep that all things in front of the organization. So automatically there is a opportunities increase from one clinical pharmacist to second, two, three, four, five, six. And if you are doing just a simple ways, it's just the primary stages. So you can't expect or you can't get the supportive hands. So that's why you want to improve your processes, value added services, which will give a benefits to the patients, which will give a benefits to the other healthcare teams, decreasing their timings. That will be giving a chance to the clinical pharmacists which can grow in the healthcare systems. Okay, so everyone knows this thing. That's why I'm not going to concentrate. Then we will go next. There is a functions of clinical pharmacist. What is the functions? Already we are discussed and okay. So there is a 15 functions as we can say. What is the functions of clinical pharmacist in the healthcare team? So taking the medical history of the patient, already we discussed patient education, patient care, formulation management of drug policies, drug information, teaching and training of medicals and paramedic staffs, research and development, participation in the drug utilization studies, patient counseling, therapeutic drug monitoring, drug interaction surveillance, adverse drug reaction reporting, safe use of drugs, disease management cases, and pharmacoeconomics. Each and every step, as you can say, I am a specialized. Okay, so there is a specialized things as you can say, medical history taking, medication reconciliation. There is a one clinical pharmacist. Just think on the healthcare system. And in the healthcare system, how can we grow as a clinical pharmacist? 1 to 2, 2 to 3, 3 to 4. So automatically it will be increased growth of clinical pharmacists, increase the opportunities of clinical pharmacists. Okay. So drug policies and this everything now in the organization they will expect from one clinical pharmacist because there is a not coming of the ideas for value added services. Okay. There is a limitations. There is a lot of things, but we want to be proved. So automatically we will get opportunities. So that's only the currently working clinical pharmacists also want to do. and who are the planning to be a clinical pharmacist want to be understand how we want to be grow in the healthcare system. So these all things we are doing, and we are expecting at each and every level there is a one clinical pharmacist required in the healthcare system, because each and every steps have the strengthening the workflow, strengthening the work timings for the clinical pharmacist as a single. Otherwise, he want to limit for 10 files to one file. Okay, so that will be limitations. And if the organization will understand, no, there is the most important personal as a clinical pharmacist, we will improve the value added services, we will improve the clinical services for patient care. So automatically we will come on the health organizational minds. Okay, then as we can see, clinical pharmacy specialties is most important as Indian curriculum or Indians healthcare systems or and the Pharmacy Council of India as we are hearing. Now in JSS also started, there is a specialties for the clinical pharmacies. So we are as a student's point of view or as a career point of view, we are saying yes, there is no opportunity. Okay, but as per my experience, I will say there is a lot of opportunity. It's not only the western countries, there is India only have the lot of chances of clinical pharmacists to grow up, to start the services, to expect the something. Because when you are working in the healthcare organization, there someone is the someone consultant or physician will look into something in that and he will take you in his specialty. So automatically you can grow on that specialty. And when you are taking chance to grow on that specialties, it will give you immense knowledge on that specialty, and you can do all things related to that specialty. Okay, so usually it's required residency in specialty area in addition to the pharmacy practice residency. It's a western countries, but in India, as a pharmacy candidate in internship, we will posted in one of area, general medical wards, surgical wards, gynac ward. So it's a not just to go or take a rounds and to take a file and to just present in front of the academician. No, it's your specialty area where you want to be understand everything, where you want to be take a knowledge from everything, and you want to be grow on that as you are 2 months periods in the one ward. So you want to be take all your efforts to learn on that field, to learn on that specialty area. And if you are specialized in that area, so you can grow on that area. There is a lot of scope in specialized areas. As we know that oncotherapeutics, TCS is giving a fellowship in oncotherapeutics. What is the requirement of fellowships in the oncotherapeutics? If you are a clinical pharmacologist in viewing of all areas, there is a lot of oncotherapeutics consultants are there after MBBS. So we are organizations and everyone is looking at just for the documentation. If you can ask the oncotherapeutics role in fellowship, he will not do the clinical reviews. He will just do the documentation of research works. Okay, and if you want to be clinical pharmacy specialist, you want to be work in the clinical field. You want to be work on the patients. You want to be work with the healthcare team as a consultant with the consultant as an assistant. That will give you a knowledge on that. This is the things we want to do. Job function depend on the specialty and the institution. Usually, are the teaching and research responsibilities represent pharmacy for the medication surgery meeting and specialty areas. Okay, so as I can say, PHG college will also start at the onco specialty for the clinical pharmacists. As I saw, there the Keralian clinical pharmacists who are the specialized in the specialty ward, neurology and all things. It's not that the clinical pharmacist is appointed as a neurologist special clinical pharmacist. There is a someone who developed that thing. Okay, and there is a consultant or the physician who will expected that if clinical pharmacist is required for my specialty because he saw something in that clinical pharmacist. That clinical pharmacist will keep his efforts to develop that thing. Like that, we want to be keep growing with hands to hands, and then we are getting a lot of opportunity. And now also I have the opportunity. Just we want to grab that. Okay, these are the specialties as we can see clinical pharmacy practice specialties that we will see in the ambulatory care, critical care, drug information, geriatric. Already I said you cardiology and every specialty required a clinical pharmacist. I will not going to discuss on all specialties, but we can just discuss on the ambulatory care clinical pharmacist. What is he doing in the ambulatory care? So what is the ambulatory care services for the clinical? There is an anticoagulation As a clinical pharmacist, how can we go the anticoagulation management? Question to everyone. So just understand what is anticoagulation management. Yes, there is the most important role as a clinical pharmacist in the anticoagulation management team. Okay, I am also in the Hiranandani Hospital as a anticoagulation team member. So as anticoagulation team member, clinical pharmacist, in that my role is to counsel patients who are in anticoagulants like warfarin, aciclovir, or the other anticoagulant drugs, or to monitor their INR, PT-INR, because INR depends on INR, PT-INR. We want to be decided dose, want to be decreased, or what the decisions what that patient want to do. That is a continuous counseling is required for that patient, a continuous review of that PT-INR levels and their neurological, like anticoagulation. We want to be take a patients of pulmonary embolism, VTE, venous thromboembolism patients who will on the anticoagulants or factor 10 inhibitors. In that specialty, as we can see, neurology, cardiology, and orthopedics. These are the three specialties we will use the anticoagulations. So for these three specialties, there is a requirement of clinical pharmacists for the ambulatory care. Okay, and there is a team, and in that team, there is a clinical pharmacist has a main role to take all patient reviews and to discuss with the other team members and to take a best possible medical treatment suggestions and advice from the team members and provide to the patients. Okay, cholesterol management, endocrinologist or cardiologist, as we can see, cholesterol management, what is the medicines that patients will take, what is the drug management, how he will take, when he will take, what is the pharmacokinetic dynamics on that everything we want to be discussing. Renal management, oncology services, home health pharmacy services, impact on pharmacy services. There is a, as I can say, there is a huge opportunities now started as a home healthcare pharmacy service. Okay, so patients, as we can see, the pandemics in this COVID-19 pandemic, there is a patients not interested to come in the hospital just because of COVID. Okay, they are a COVID positive, so they will stay. They will think to stay at home only and to take care at home. So healthcare also started a home care packages for COVID-19 patients. So what is the role of pharmacy services in that? So that there also your role is most important to talk with that people regarding their therapies, their improvements. It's not the responsibility of physicians or consultants, it's the responsibility of pharmacists or clinical pharmacists to review their all parameters or their improvements in that and decide a therapy and means decide in the sense with suggestions of the clinicians or with discussing with the physicians and clinicians, then decide a therapy and to inform to the patients what you want to change, because if that the patient is not being improved. This is a very huge opportunities for the clinical pharmacists who want to come up out of their minds and to join the home care pharmacy services or home healthcare services. Okay, there is a lot of home healthcare services starting instead of the healthcare, because there is a chronic disease patients who really require, or there is a single patients who will stay at their homes, they will expect the service at their own homes, and there is a people also started to do a healthcare setting at home only. So it's opportunities for us to grab it. Then neonatal ICU for management of drugs, uh, pulverizations, compounding. So that is the neonatal ICU where is the clinical pharmacy is required. Oncology, as we can say, chemotherapeutic infusions and infusions preparations means what is the whatever the medications required, how much dilutions, how much rate as per body surface area, what is the dose is required for that action, that calculations, everything will be done by the clinical pharmacist, prepared by the clinical pharmacist, and then sent to the nurse and to educate the nurse how that medicine want to give to the patient and which rate and how we want to monitor the parameters in that patient. That everything will be done by the clinical pharmacist. Hypertension management, integrated coronary vascular diseases, HIV and infection diseases, new member program like assist new MD in the prescribing national formulary to the formulary drug. Sorry, non-formulary to formulary drugs. What is the protocols on that? What is the ambulatory services as we can provide in the assist the medical doctors to formulary and non-formulary drugs? heart failure management, because as you can see, there is a lot of regulations comes under Food Drug Administration, or CDSC also working on that. PVPI is also working on that. So there is a lot of drugs continuously coming in market, going from the markets. There is a lot of cost effectiveness, or as we can see, drug price related issues. The drug will be removed from the markets, but that drugs have the good results. So what is the formulary non-formulary? What is the scheduled drug that want to be decided by the clinical pharmacist? Give a best possible therapies with formulary development for the healthcare. Asthma management, heart failure management, that's all things will be coming under the ambulatory care. Okay. Am I audible?
Yes, sir.
Okay. Now we are going to discuss on the hospital pharmacist versus clinical pharmacist. As I know, we are not going to, as myself, I'm not keeping a difference between hospital and clinical pharmacist. We are a team of healthcare. We are no have a difference, but there is a minds who have the there is a, because healthcare culture, we are just came now in the market, but there is a people who is long term from in the market as a hospital pharmacist. We don't want to be keep difference in that, but difference in the things hospital and clinical, this is a just one difference we have in the healthcare setting. Okay, so what is the role of hospital pharmacist and what is the role of clinical pharmacist? So here, as you can see, hospital pharmacist, sorry, there is a, okay. Sorry, it will just hanging. So as a hospital pharmacist, as we can see, there is a VED services or ABC, means vital essential drug and always better control. That will be comes under hospital pharmacies. Okay. Then what we can say, management of their stocks management, then inventory management and purchase management. That will be comes under hospital pharmacist. That will not look for the clinical pharmacist. But as a clinical pharmacist, we need to know, or we must want to know about the pharmacy services. Then you can take your place in the medication management units as a quality coordinator. If you don't know the services, because you are the person who will coming up in the view of healthcare team, means in front of the physicians, who is the first person as a pharmacist, clinical pharmacist. Whatever the problems related to pharmacy services, he will comes us to clinical pharmacist. So you must need to know the services, what is happening in the pharmacy services. There is a difference in hospital clinical. May I audible or just disconnected?
No, it's audible, sir.
I'm not getting you.
Deepak, it is audible. You can continue, Deepak.
Okay. So here, as we can see, patient get right care from the all facets. All the drug related problems can easily be eliminated. Physicians and other healthcare professionals get more focus on their own work and workload in the low. Patient feels more comfortable. So here we are coming under the view. Okay. So as a clinical pharmacist, with the supports of the physicians, because as we know that there is a lot of workload for the physicians, because a lot of patients comes and goes. So, and there, as we can see, patients come just within a 2 minutes, they will come back to the out of the chamber of the physicians. So there we can take our steps, and we can take a time for that patient, and we can just discuss with the conditions and motivate the patient, lifestyle modification, a lot of things. So that will be give chance to the clinical pharmacist to get opportunities in the healthcare systems. So every drug is a poison, as I gave the phrase. It's the dose that differentiate poison of the drug of substance is. Means what? Every drug is a poison means what? Every drug, as we can say, it's poison, but it's appropriate for that patient. It's appropriate for his conditions. That will be benefits for that patient. Or who is not appropriate for that patient is like a, as we can say, that if the habituals, the drug addicts. So for that patients, as we are giving a drug, so it will be addiction, it will be poison for that patient. Okay, so it will difference from that. And by the physician point of view, when he is treating a patient, he don't know the past medication history of that patient. He will start the new therapy, and that patients will be goes to the four more doctors, four more specialties, and four more specialties give the four more medications to him. But I don't know. As I am a physician, he come to me. I don't know what is the medications he taking. So there is a drug related problem. There is a drug interaction may can happen. There is an adverse drug reaction may can happen. So that is the things we want to understand, and we want to come up with the idea of counselings, or with the idea of OPD medication optimizations and pharmacotherapy management. That in the new opportunity for the clinical pharmacists, we can grow in the field of the healthcare as a clinical pharmacist. So to kill ill by pill, not by bill. Okay, in the healthcare system, in Indian healthcare, as we daily see the news in the newspapers or in the uh, uh, televisions. So we want to be care for patient by their therapy managements or their critical conditions or their clinical management, not by bill. That I added here because that is a lookout. Healthcare system means every patient will think that there is a lot of bills will come. I want to go home, but there is most important thing: patient want to be get cured and they want to go home. Okay, so what is the criteria? What how the clinical pharmacist look comes in the look of this? So he comes in the look of this by pharmacoeconomics. Okay, so as we can see, effective drug and everything, we know that all things. But patient related, what is his background? His background is lower background. So what type of drugs we want to give? There is a lot of brands are available in low cost also, high cost also. Okay. So as per that, we want to be manage everything. Pharmacoeconomics, pharmacoepidemiological survey. What is the diseases comes in my area? So as per that diseases, I want to manage my formulary stocks. That is a high level also, low level also. Indian healthcare is not that just to high levels of medicines and high supplies of medications in the healthcare, and the patients will suffer just because of bills. No, there is a low cost medications also available in the healthcare system which will give to the economical patients. Okay, but that drugs also have the greatest effect, and that management want to be done by clinical pharmacologist or clinical pharmacist. He need to understand that thing, and he want to come in front of the management that that is my role also, sir, and I am doing the best. If that patient have the problem, so I will manage that all things with the discussion with the pharmacy. Okay, there is growth is also required for the healthcare system, and there is a patient care also required. Both balance is required, and that clinical pharmacists want to be understand that thing, and you want to come up with the ideas. The last person to be involved in healthcare team with the patient pharmacist. So the system has to be really upon him and her. Okay, everything will be completed, and when the patient goes out from the hospital, where he goes first? He goes to the pharmacy shop to take a medication. So last person is a pharmacist, and pharmacists have the more important things he want to be developed in his workplace or in his practice, that he want to be counsel a patient appropriately on medications, on medication related problems, on lifestyle modifications and everything. So for that also you want to be develop his own knowledge on the drug therapy. I will not say that there is no opportunities for the clinical pharmacist. Yes, as is a OPD or in the pharmacy shop also, as you are interested to start, you can start that, because you are the last person who comes to patients first. Okay, after healthcare. Okay, and when patients comes to you, you are the most important person to develop his therapy plans. Okay, so just understand there is a lot of opportunities for the clinical pharmacist at each and every levels in the healthcare system. Just we want to understand how we want to be keep a steps to grow that things. Okay, so after that, as we can see, there is a service without a pharmacist and clinical pharmacist. Due to the high load of physicians, I already discussed, patients may not be feel comfortable. The same line, working with your medicine, maybe you Okay, then we are goes to the pharmaceutical care. There is a clinical pharmacist role comes under pharmaceutical care. Same things, just here with the understanding cooperations with the healthcare teams. What is the pharmaceutical care we are giving in the professional way? So it describes the specific service activities through the which an individual clinical pharmacist cooperate with the patients, other healthcare professionals in the designing, implementing, monitoring, and therapeutic plan that will be produce specific outcomes for the patients. Last half an hour onwards, I am discussing same things to you, but it's the term which is pharmaceutical care, which comes for the clinical pharmacist who will working in the healthcare system. How he is working, that we'll see. Drug monitoring, disease monitoring, drug therapy, and disease management collaborative practice. These three main parameters. Okay, we want to be keep it in our mind, and we want to go thorough with that all things, and then the workflow will start for the clinical pharmacist in the healthcare. Hello.
Yes, sir, you can continue.
I'm not getting voice. Hello?
You can continue, sir.
Okay, okay. Sorry. So as a there is the next lot of slides are there, but we will just go with clinical skills and clinical pharmacist related discussion in the pharmaceutical care. So here you can see the clinical skills and clinical pharmacist role in pharmaceutical care. So what is the role? The patient assessment in base skills like physical assessment, barrier of adherence, and psychological issue. As a clinical pharmacist in the pharmaceutical care, are you doing this role in your curriculum? Are you in the internship? Are you following these all things for patient assessments? If I can say as a PharmD candidate, we can start to do physical assessments of patients to understand how doctors will do for the disease. Okay, and it's a giving and gaining the knowledge. It's not just what is the knowledge you have. You have pharmacological knowledge, you have pharmacotherapy knowledge. It's good for you for your growth and development. But you need to understand what is the diagnostic knowledge. Okay, and that you can learn from your physicians or the consultants. Physical assessments that you can learn from them, and it's a giving and getting knowledge. Okay, so that will be most important in this pharmaceutical care. Okay, so what is a physical assessment? As I can say, as a pharmacy candidate, can you able to do the blood pressure monitoring? How to check a blood pressure, how to check a cough pressure, how to check uh, patient's heart rates, how to do physical assessments of patient, what is the way of physical assessments, what is the steps of physical assessments of patients. No one knows. So this is the things we want to learn in our curriculum, and that want to be as I already suggested. When you the next syllabus will come, these all things were already it's included in our, but we are not practicing. Okay, so just start to practice that all things. Barriers of adherence, barriers to adherence. Okay, then psychological issues. Okay, then patient assessment, psychological issues, as we can say, and barriers to adherence, as we can think in our minds. So we want to be give a support to the patient. Okay, that is a clinical skills in the clinical pharmacist for the pharmaceutical care. Okay, so you want to be understand what is psychology. If you are going in front of patient for counseling, and you can say, as that patient is a chronic patient, chronic disease patient, and he will take a medicine from last 10 to 15 years, and you go in front of him and sir, you can tell, sir, this is the glycomed you have to take before food, after food, and if after getting this medication, if you have any problem, just inform me. What he will say? He will just say, I'm taking this medication from 15 to 16 years. You came now and you are explaining me now. I'm not interested to listen. First, see the psychological barriers, psychological issues, assessments of that patient. That is most important. You want to start with the communication. You want to be start with the clinical things. First, you want to be understand what is the psychology of that patient. Then you want to be go front. If you are starting these things, so you can't get improvements and you can't get the activeness in the your practices. Okay. Then education and counseling skills is depends on assessment skill. This will comes on that counseling, interview skills, communication skills, ability to motivate and inspire, develop and implement patient education plan based on initial education assessments, identification and resolutions of compliance barriers. This all things will comes depends on these three parameters. Okay, in the pharmaceutical care. If you want to be develop all things, you're learning these all things, but it comes by practice in your career, in your uh, uh, pharmacy practice, in your daily workflow. It's come by daily workflow. It's not just by reading the books and just writing the exams and it will just following the what is the curriculum just for passing the exam. It's not coming by that. It's will coming by your practice. It's coming by your workflow. It's coming by your motivation. Okay. It's coming by your aim and object in the healthcare system. Okay. So it's a clinical pharmacist role. It will not just a simple role. It's a comprehensive role. It's a how the everything is covers in that. You can give advice to every department if you have knowledge on every field. It's a main, as we can say, value added personal, or you can learn a lot of things from the healthcare when you are doing a practice. Not only the clinical things, there is a non-clinical things also you can learn in the healthcare if you are interested. And then it will give a most opportunities for you in the healthcare system for the clinical pharmacist. Then patient specific clinical pharmacist care in plan based skills. So recognition, prevention, and management of drug interaction, pharmacology and therapeutics, interaction, interpretations of lab test, knowledge and community research, professional reference. So this is the skills. I think so. I already discussing this all things from last 1 hour, but I'm just giving you the idea. What is the uh, processes or what is the things you want to keep it in your mind to understand the clinical pharmacist role and to opportunities for the clinical pharmacist to grow in the healthcare. Okay, so this is a patient specific field. Then drug treatment protocol based skills, development, maintain a protocol, follow protocol of clinical pharmacist clinician, monitor, aggregate adherence and treatment protocols. Like every treatment, pain management have their different protocols, stroke management have their different protocol, cardiac management have their different protocol. So it will be prepared by the physicians. But if you can take advice from the clinical pharmacist, that will be very different way. Okay, and that will give immense exposure to the clinical pharmacist to prepare that all things, and it will be uh, quickly access reference for the physicians when the patients come on that conditions. Okay, so these are the protocols we want to be developed by our own ways with the healthcare teams. Okay, then drug adjustment based skills. Lot of clinical pharmacists, as I can say, in the healthcare settings or healthcare setting or organization also not expect that things from us, but it's our role. So my question is to you all: can you expect this all things? Can you adjusting the drugs? Can clinician asking or clinician accepting you to do the dose adjustment? This is the questions. First question is, can you do that? If not, then start to do. And if you are doing, then how you are doing? And how you are doing, then clinician can accept it that or not. So this is the thing. So adjustment based skills is to sub-therapeutic response. Means you want to understand the therapeutic ranges. You want to understand the toxic levels. You want to understand the pharmacokinetic dynamics. Everything you want to understand depends on that. Like every formula you need to know. For pediatrics, there is child formula, young's formula. That's you want to know. Creatinine clearance. That all formulas you need to know. Then you can do the dose adjustment. So these all things you learned, but not kept in practice. Start to kept in practice, you can get interest on that. So that is the role of clinical, and that is the skills developments in you to develop your curriculum or to develop your opportunities in the healthcare. Then prospective authority, designated practice site and the positions. Okay, so there is a different position. As a clinical pharmacist, I am saying, but Indian healthcare will give you a different opportunities in the healthcare settings, like quality coordinator, like research associate, then clinical pharmacist, then as you can see ethical committee member, as you can associate, you can work as we can antibiotic stewardship committee member, infection control committee. There is a lot of opportunities for the clinical pharmacists in the healthcare, and every role have the different role. Every role have the different suggestions. Okay, then this is just one overview effect of drug therapy on what is the safe drug therapy, what is the role. Then as a clinical pharmacist, what we want to keep it in mind? We want to keep it in mind, we take a proper therapy for the patient. Is drug effective or not? If that drug is safe or effective or not? What is the pharmaceutical care aim that will be covered in that? So we want to keep it in mind economics. We want to keep it in mind how the patient will improve, how that drug will be safe for that patient, and what is the efficacy of that, effectiveness of that drug for that patient. So everything will comes under pharmaceutical care on dosage management and dose strength management and other lifestyle modification with the suggestions or with the advice of the clinicians or with the advice of the other healthcare teams. Okay, that will be discussed and then want to keep it in the files. Okay, so this is the just parameter aims for the pharmaceutical care. Then this is a question I want to keep in mind. As a pharmacy candidate, we will say they will not listen, he will not listen, they will not do, these people not do. Just think of someone in your family or friend has a something go wrong with their medicine. So I will say that start with your family. It's a lot of opportunities will start from your family. First, you introduce yourself in community. That is the first step. If you can introduce yourself in community, automatically you can grow by that your own way. Okay. So this is the first question you want to ask. If your family someone is taking medications, can you evaluate that? Can you manage their therapies? Can you give suggestions to that your family member how to take medication, what to take medication, and whatever doctor prescribes is correct or not? Just think on that. If that patient is getting unwanted, can you started the counseling for that your family member from you? As a clinical pharmacist, you want to start by your own way, by your home itself. Okay, understand these things and develop your career. Okay, so this is just understanding of clinical pharmacies. So this is just some picture that I kept related to photosensitivity where the we want to give the advices, and this is the some things which will working clinical pharmacists want to be find in the healthcare medication errors, types of medication errors. So what where is the failures will comes where we want to be actively take a part, actively actions want to be take in the healthcare settings. Where is the inappropriate medication selection, formulation, drug therapy. This is the related to medication errors where we want to be majorly concentrated. We want to be think on to decrease that things. And where the clinical pharmacist roles are reducing the risk. So these are the opportunities for the clinical pharmacists at the admission, at the prescribing, at the prospective, then drug distribution. Okay, this is the opportunity of errors. Okay, and in that opportunity, we want we have so automatic of that is one not to be covered and patient will suffer by the error. Okay. Hello.
Yes, sir.
Deepak, it is audible.
Okay, thank you, sir. Patient assessment questions that you want to be asked for the patient assessment. Does the patient need this drug? Is the drug is most effective and safe? Is the dosage the most effective and safe? Will the drug administrations impair safety and efficacy? If the side effects are unavoidable, does the patient need? So this is the counseling or this is the reconciliation on appropriateness question that you want to be asked at the time of patient assessment. Okay. I'm not saying that physical assessment you don't want to do, but with physical assessment, you want to be do a medication assessment also. And as per the accreditation, there is a terms medication reconciliation and medication appropriateness, which is give the opportunities from the government side, from the accreditation side to the clinical pharmacists in the medications management. Okay, but it's not just the documentation work. By doing this work, you want to prove your knowledge. You want to keep efforts to keep efforts to prove your knowledge in front of the organizations for the uh, patient safety by the way of value added services as a clinical pharmacist. So this is the things like, does the patient need this drug? It's not just a question. Need this drug means you want to be evaluate everything, you want to be assess everything, then you want to collect the evidences on that. And if your evidence is correct, you have to discuss with the healthcare professionals. And if you are discussing healthcare, can he is accepting on that? If he is not accepting, what is the next criteria for that? And that criteria, if patient is getting adverse drug reactions, if patient is getting any drug related problem, not improving that, then return you want to come back to your points. You want to discuss all things. You want to be discuss case on that. That all things comes under one questions. Okay. So this is the questions for patient assessment and is give you the opportunity on that. I'm not going with all questions because there is a time limit. So as a study pharmacist, we know that it's just a preparing, compounding, and manufacturing and dispensing a drugs, like saying this is thing. But now today's pharmacist, as a clinical pharmacist or the pharmacy practice professional, who will directly contact with the patients, who will give a counseling, who will decide a therapy, who will do a medication optimization, who will as a healthcare team member, who will keep an active part for the patient safety to develop a value-added services. Okay, and it's the most important person in the Indian healthcare also. So, what is the ideal pharmacist candidates? Means ideal clinical pharmacist or pharmacist candidate, as we can see, he must be a competent, he must be a motivated, enthusiastic. He have a team spirits, teamwork spirits on his workplace, good communication skills, responsible, problem solver, and dedicated. Okay, as a clinical pharmacist, as you want to be work in the healthcare, so you want to be develop this all, uh, as we can see, ideal properties in you. Okay, that we can say professional development. Okay, so you want to be like this. So no one can stop you to develop yourself, or no one stop you to create opportunities. Okay, in the healthcare settings, it's not just in one setting. You want to be developed, you can stay at one place, but you can develop in a lot of other places also. Okay, just you want to develop the things on that. Then this is only the session that I want to be uh, explain you, and I completed my session. If there is any question, you can ask me. But it's not just the end, it's a beginning for the clinical pharmacist, as we can work as from last 10 to 12 years, or we are struggling to get opportunities in the clinical pharmacist. This is just one healthcare system which will understand if you are proving yourself, if you are keeping your efforts to uh, prove yourself in front of the healthcare system. I'm not saying that government want to create opportunities, students want to do strikes. No, it's all the ways that is not for the pharmacy candidates. Pharmacy candidates have the only one chance, that they want to come up with their ideas in front of the community. They want to come up with their capabilities in front of the community. And if once the community will accept you by your thorough knowledges and by your practices, automatically government will think on that. And as I hear, government also starting to appoint a clinical pharmacist different sectors. Now is the next two sessions are related to that only, pharmacovigilance. But pharmacovigilance is just one entity for the clinical pharmacy, or for the pharmacy candidate. Okay, if you want to be thorough in all entities, you are, as we can see, pharmacy candidate, it's for the clinical pharmacy role or clinical pharmacologist role. Okay, because he can get all opportunities in this one single opportunity. Okay, pharmacovigilance is not give a brief idea about patient care, it just give a drug related problems here. Okay, patient care, if you want to go with the patient, you want to be thorough with all knowledges, and this is the role of clinical pharmacist. Thank you so much. If any questions?
Thank you, sir. Thank you for the detailed overview of clinical pharmacy or clinical pharmacist work and responsibilities. So let me ask one question, sir.
Yes, please.
For a fresher, like immediately after a family graduate, if he wants to enter into a clinical sector,
Yes.
so what you suggest them? Like, what are the individual qualifications or individual skills they need to have immediately after internship?
See, already, as I can say, as a PharmD candidate, it's a higher qualification. As I can say, higher qualification. We don't want to do extra qualifications or extra things. Just if you have practice or if you have interest, you can do extra qualifications. But as a PharmD candidate, everywhere you can get opportunity. Skills that I already discussed in my sessions. What are the skills you want to develop in yourself? If you want to come in front of the community, you want to prove yourself. Okay, and that all we are learning in our PharmD curriculum. Okay, where PharmD curriculum is designed means is design is the base on that only clinical services. If you can go thorough with your curriculum, so no one can stop you to get an opportunity as a clinical pharmacist. There don't take or don't start to believe on other people's, or as I can say, believe on your curriculum. Don't means don't think on the questions want to come in your mind negative to negativity of the government or the other sectors, that they are not starting the opportunities for pharmacy students. As I can say, start from yourself. So automatically opportunities comes from front. Okay. See, peoples are giving references, students will come, but if they don't have capability to prove themselves, so automatically there is no opportunity. And as I can say, in the community, if you are prove yourself, I will tell continuously, if the people, students will go out of India for growing their knowledge or for growing their career in the clinical pharmacy. But after going there, what they will do as a pharmacy candidate, as a pharmacy technician, they will work in the pharmacy. Okay, they will work in the specialty units. Okay, there is a difference. Pharmacy technician and specialty, clinical pharmacy specialties. There is a two differences. You want to understand that. Pharmacy technicians, if you will goes to out of India for developing your career in the pharmacy technician, so why not in India? Start your community pharmacy, start your pharmacy shop, start your clinical services in that. You can develop yourself in that. So why not you are starting in India? Why you are going to away from the India and you start there only? You are doing same work there. The same acceptance you want to be develop here from the community. That is only my answer to you, to everyone. Opportunity starts from you only, not from the healthcare or not the expectation. Because every healthcare now, if the as I am giving you the idea, NABH, National Accredited Body for Healthcare, Board for Healthcare, they are already have the fifth edition developed. In that, they are directly mentioned. There is a mandatory for the clinical pharmacologist for medication management. Okay, so from government point of view in the healthcare, every healthcare also started to appoint a clinical pharmacist. Just requirement is one, but if that clinical pharmacist will develop his career or he will prove himself in front of the organization, automatically opportunity will increase. So understand your efforts. Understand no, so believe on your efforts and to prove yourself in front of the organization.
Yes, sir.
Any other questions?
Thank you, sir. And in the starting days of your career, what are the barriers you faced? Because you were from the first
See,
batch.
there is a lot of barriers.
Yes.
Uh,
Can you share that experience?
yeah,
Because you are from the first batch.
there is a there is a lot of barriers in front of me as I am came up with the I just passed out and just started my career in clinical pharmacy only. So there is a very bad experiences. There is no acceptance. There is a means lot of bad things will happen. They are not accepting you. They are demoting, demotivate you. They will just Means there is a lot of bad experiences that not clinical related, but there is a practice related, or you can say acceptance, ego, attitudes. That's different things, and that you want to learn by your communication. That you want to develop by your communication. Okay, because these demotivations and disacceptance and disagreements, that's all things you can cross, or you can come up with the newer growing or your opportunities by your communications. Okay, that all things will be depends on your communications and or inspirational skills. Okay, so whatever the doctors, when I came in the market or when I joined as a clinical pharmacist, there is no acceptance at all from the client. There is only one thing in mind in the organization: clinical pharmacists just do a documentation work, cross checking of the medication what your doctor's writing. There is no advice on the therapy, there is no corrections on that, there is nothing. Okay, just he will, the person who will cross check the treatment sheet and what are the errors finding, just writing the error form and just keeping with him. There's no discussion with the other people, there's no discussion with the consultants. It's up to him, and that is not the clinical pharmacist role. Okay, so acceptance you want to create. Okay, clinicians want to accept you, clinicians. So I started to grow up by that way. I started to talk with the physicians. I started to discuss with the physician. I just whatever the things I'm getting in the file, whatever the things I'm getting in the my review, so that I will discuss with the physicians. I will understand. If they will ask me questions, if I know that thing, I will tell. I will explain by evidence. If I don't know, I will take a time to read and to come up with the evidences. And if there is nothing that you can say ki, I don't know sir, because we are not people that keep in everything in our mind. Okay, we want to be updates, we want to be keep updations on daily basis. Okay, we can't keep everything in our mind. Everyone knows that things, so it's not thing that you can't ask anything. Okay, go talk with physician, ask the questions. If he will also ask the question, try to give answer. If not giving answer, tell him to I will come back to you. Read it, come back to him, give answers. And you want to learn something, ask them. They are also not saying that you are learned and this thing. We don't want to cross anything, we just want to be grow. We just want to keep it in mind, we want to grow in the healthcare system to create opportunities. So that is only the my thing. Means as my experience as a first when I started a career, to a lot of hurdles are there. There is no acceptance. There is a physicians we will just in their own mind, because they have a lot of experiences and they just come out, and we are just, when we are going in front of them, they are saying no, I know, I am practicing from 12 years onwards, I know the therapy, and you are just came now and you are saying me this thing. That is a way of communications, how you are going in front of them. So I learned from that. I just change my communication in front of them, automatically acceptance will increase and automatically my practice will improve. Okay, so this is the only one suggestions for you for the development of clinical pharmacy when I started my career. But nowadays there is a change in scenario. Every healthcare will understand the role of clinical pharmacist, because in on paper or in on the pharmacy practice regulations. So everyone will understand the role of clinical pharmacist, and they will just developing their job descriptions, and according to that we want to be work. Everyone will be accept you. There is nowhere, as I can hear, that the clinical pharmacy is uh, not working properly or not giving his suggestions everything, because they are expecting that thing because it's on paper and it's done by the government for the clinical pharmacists by developing pharmacy practice regulations. There is updations which comes in the 2019, I think, but because of pandemic, it will be longer, but it will come as early as possible, as I know. Thank you. Any other questions?
Thank you, sir.
Dr. Deepak, it was very finest presentation. And we are able to
Yes, sir. Thank you
visualize
so much.
your expertise Yeah, we are able to visualize your expertise based on your experience. And I think your growth factorial are very good in the areas where you are working. And you have shifted, I think 2 or 3 hospitals you have shifted, and your experiences of the hospital is directly reflected in your presentations. It was very
Yes,
finely
sir. Yes.
given. Yeah. So
Thank you, sir. Thank
was,
you.
thanks a lot, sir, for being with us.
Yeah, that also
Maybe
I
your
want to add for
shared.
the participants.
Yeah.
Yeah, I want to add in my participants for that. I work in the corporates also. I work in trust hospital also. I work in the five-star hospital also. There is my 3 last assessments, which will give me different expenses and different exposures to grow up in high level. So it's
Yes.
not just
Yeah.
that I'm growing in the clinical pharmacist level, but I'm saying it to everyone: grow by way or start from your way only. How you want to grow in healthcare, so automatically acceptance will increase.
Yes. Yes. Good, sir. Thank
Thank you
you.
so
Thank you
much.
for your time, sir.
Thank you,
Okay,
sir.
sir.
Can I
Yeah, sir. Sure, sir.
go
Yeah,
off?
sir. Sure.
Thank you.
Thanks. Thanks a lot.
Thank you.
Thank you so much.
Thank you, sir. Thank you for joining with us and sharing your experiences. With this, we are winding up the first session. I request the participants to join for the afternoon sessions, which we are having in the afternoon from 1 to 2 and 2 to 3. We are having 2 more sessions. I hope we all meet there. Thank you, sir.
Yeah,
Thank you for
one more thing is anybody require any questions to be clarified, kindly write in the WhatsApp group. So
Sure.
what we will contact with Deepak sir, and sir will be giving you all the explanations. And this is a platform for very advanced learning from those who have realistic practices in the clinical setup. So kindly use this opportunity, be connected with Deepak sir. So what we think we can meet in the second session afternoon by 1 o'clock, which will be given by Dr. Suvarchala regarding a pharmacovigilance and drug safety. And she's a candidate working in WIMS Hospital, Bangalore, under PVPI IPC program. Sure, the first facet of hospital setting, I think it was very well elaborated by Dr. Deepak sir. And the very next entity is pharmacovigilance in India. I think Suvarchala madam will be able to defend all the points what you have to be getting clarified. And I think this will be a multifaceted opportunity for all the participants. So kindly use this platform and let me create wonders in the years to come. Thanks a lot. Thank you, Sayati.
Thank you, sir. Thank you all the participants for joining with us. We'll meet in the afternoon. Thank you.